crazy thing is, like, they told me to stay out of the sun. They also told me to wear sunscreen. The more powerful the light, the greater treatment versatility you have. When ultraviolet B hits your skin, is it stimulates melanogenesis. That's the formation of melanin. That's the pigment that shields us from the sun. Particularly when the light like blinks, it causes central nervous system dysregulation. It can cause seizures in epileptic people.
Well, I have a very exciting discussion coming up today with Kris Sweeting. He is the founder of emr-tek, and you may have heard about this company, all about red light therapy. He's got some new innovations coming and already launched as well. I am super excited about this conversation that we're about to have. Welcome on in, Kris. Thank you so much for joining me on my podcast today. It's such a pleasure to be able to speak with you.
Yeah, thanks for having me.
So let's get right to it. So can you tell us a little bit about how you got into, this world of red light therapy?
Yeah, so I mean, it started off with just, well, when I was 3, I got vitiligo, which is the same disease that Michael Jackson had. It's when your skin turns white. You can see some on my hand still. You can
Oh,
see on my
yeah.
thumb and like the well, my palms there,
Yes, yes.
towards the wrist. I couldn't repigment like my hands and feet. It's just because they're getting like um, they're essentially exposed to like a lot of chemicals through like washing your hands in the sink or washing dishes and like constantly rubbing on your shoes and socks and all that stuff. So most people never repigment their hands and feet. It's like a really common thing. But yeah, so I had vitiligo. I got it when I was 3. We tried all these, we probably went to like 20 dermatologists and naturopaths all together all over the
Wow.
United States and Canada.
Yeah.
I had, by the time I was 5 years old, I had like full blown 4-door tanning beds in my room.
Wow.
I had like PUVA treatments that I was trying. Those didn't really work. I would have to put on like cortisone cream, this like tar cream. It smelled terrible. It was
Mm.
disgusting. Obviously, I hated that. I didn't really understand what was going on with my body. By the time I was like 9, and it was just not working. Nothing was working. They said, stay out of the sun, wear sunscreen, and we can get to why like that would have been absolutely the worst thing to do.
Right.
But
Yeah.
so stay out of the sun, wear sunscreen, like, and there's not much like they can do about it. And by the time I was 9, it had spread all over my body, all over my face, all over my neck, literally everywhere on my body. I was
Wow.
like covered. It was pretty disfiguring. Like, I don't know. I remember being called like any spotted animal's name. Like I've been called that.
Oh my
You know what I mean?
gosh.
And then,
And that's
there was that.
traumatic yeah, I have boys, so that's traumatic at any age for a boy, but I can't even
Yeah.
imagine.
Well,
Yeah.
exactly. That's exactly how I felt actually, because it was around the
Yeah.
time I started liking girls, and that's
Yeah.
when it started. Like the girls were like the ones who were like saying shit. So, and like, did you pour acid on yourself? Like stuff,
Oh my
comments like
goodness.
that. Yeah, vitiligo is actually one of the more. If I think it's documented to be the most psychologically pathological disorder to have in terms of like a cosmetic thing. Um, and Yeah, so long story short, it was really disfiguring. My mom, through library research, she found a German doctor called Dr. Karen Schellreuter, who was a PhD researcher for vitiligo and pigmentary disorders. And then also she was a dermatologist in Germany, and we flew out there. Turns out there's a treatment. It's got a 95% success rate.
Wow.
Still nobody really knows about it.
Wow.
And it's not being used very well. But it's 20 years, 30 years, maybe older than that, and
Mm.
essentially there's a blood test that you can take to actually see if it's going to work for you. So you don't actually have to invest the money in
Wow.
the cream or the ultraviolet light. You can actually see if this is a good match for you, if you're going to benefit, and it's 95% successful. So
Wow.
we went there within, essentially, I was prescribed a cream called pseudocatalase. It reduced epidermal hydrogen peroxide. Hydrogen peroxide is what you put on your hair to bleach it. It turns the hair essentially like white.
Right.
It
Yeah.
also destroys melanocytes.
Mm.
Okay, so vitiligo patients have too much epidermal hydrogen peroxide, and that was the case with me. Um, And so this cream reduced the hydrogen peroxide acutely, and then it also elevated an enzyme called catalase. And then I would wait 10 minutes and I would go in narrowband ultraviolet B light.
Mm-hmm.
Um, I had a tanning bed at home, and so I would put the cream on, wait 10 minutes. It would lower the hydrogen peroxide, increase the catalase. I would go in the narrowband ultraviolet B, and it literally brought my pigment back in my skin all over my body to the point where you can't really tell anymore.
Wow.
Um, and so the crazy thing is that it's ultraviolet light, and sunlight was actually better than the UVB. You could put the pseudocatalyse on and go into
Inside.
the sunlight was actually better. But the crazy thing is, like, they told me to stay out of the sun. They also told me to wear sunscreen. And actually, if like a lot of sunscreens have titanium dioxide nanoparticles in them.
Yeah.
If you go into a chlorine swimming pool, which is like pretty normal because most of them are not salt water, so you
Right.
put the sunscreen on, right? You go in the pool, it uncoats the nanoparticle,
Uh-huh.
and that titanium dioxide uncoated nanoparticle interacts with your skin and generates epidermal hydrogen peroxide. So specifically, so you can't always trust what these people are saying to you. And I mean, this was the consensus from like 20 doctors, you know.
Wow. That's
And this
crazy.
information, yeah, it's published. It's like 30 years old, and I don't really see it being used. And you know, so yeah, that's how I
Well,
got into light therapy. That was my introduction.
wow. So then did you study engineering? Like how did you translate that now, your personal experience into like actually making lights?
Yeah, so I've always been like sort of like a little bit of an introvert, kind of like technical. I have some electrical knowledge. My dad's pretty technical as well. He was like ended up at the end of his career being a 5G contractor for Huawei. He
Uh,
actually brought Huawei into Canada, and he was in telecom and wireless, and I also read a couple books, and I have really great engineers that I was working with. So yeah, that's really how it came to be. But I would draw the lights on paper, and then I would
really?
forward them, yeah, to my engineer. Like even my Firehawk, I remember like Duncan Keith. That's the one. Like all the Khloe Kardashian actually bought 6 of them for her entire family last
Wow.
Christmas, and then she publicly endorsed me, and
Well, that
she actually
that
paid
was
me.
that was that's pretty good. Oh my goodness.
Yeah, I
Yeah.
know, I know. I think it's usually like $400,000 for an Instagram story from
Wow.
Chloe and like 800K from Kim. But I, yeah, she actually ended up paying me and then doing it. It was very nice of her.
That's nice.
But
Well, that's when you know that you're on the right path, right? When that just magically happens, right? You're definitely doing
Mhm.
what you're meant to be doing. So that's confirmation for sure.
Also, when your ex girlfriends come back and buy your product,
Oh,
that's when you know.
wow.
Yeah, yeah. So that's another marker.
Ah, that's
Um,
good.
Yeah. So essentially, I was when I was when I repigmented my skin, I was around 14 years old. I was working out a lot. I was like kind of a science guy back then. Anyways, I really liked biology, and I would like read. Like I was like, oh, how can I optimize my testosterone with like herbs and stuff like that?
Right.
And I came across some information back when I was 15 years old that like you could like I think it was Ben Greenfield saying that you could like triple your testosterone. By the way, I just talked with Ben Greenfield. We're gonna probably set up a deal. He hit me up on WhatsApp the other day.
Oh, good.
Um, but yeah, and so that got me interested, and yeah, essentially it was like shining light, red light down there could increase testosterone up to like 300%. There's some other studies that show like 8 steady days of reddening on the chest increases testosterone 200%. I mean, that's
Yeah.
pretty significant. And so I started reading like everything I could. Like I was a really weird kid. I would like sit down stairs and like print off like PubMed studies and like highlight them. And
Uh-huh.
but all about phototherapy and endocrinology and like all this stuff. And like it started off with okay, like ultraviolet B increases vitamin D. Vitamin D's connection with testosterone, and like I just went down this huge rabbit hole and never stopped for like 10 years. And by the time I was like 18, I was literally putting a transdermal pregnenolone on my arm and trying to direct the conversion with light to testosterone. So
Wow.
like my parents thought I was nuts. Yeah,
Wow,
yeah,
so
yeah, yeah.
you're your own like experimental sort of subject, right? Yeah.
I used to do that all the time. Now I'm just kind of like more like trying to be a normal, just, you know, business person. And I like talking about this stuff. And I think now it's like because I see a lot of problems with products being made in the industry, not only
Yeah.
products but information. I feel like because if you, I don't know, you follow me for a while, I think,
Yeah. Oh
and
yeah.
like
Yeah.
I've only been starting to like get myself out there, and it's
Yeah.
the reason is like I feel like an actual like moral obligation to kind of like
Yeah.
talk about this more because I see PhD researchers even that are like really credible in the industry. One was like talking like, oh, like, you know, it's okay to like let the ultraviolet light from like a synthetic source like into your actual unprotected eye, like not even closed, open. And it's like, yeah,
Wow.
but that depends on the context of the situation, the device. It's
Yeah.
totally you know, like contextual. Like, so someone is gonna mistake that information, go
Exactly.
into a narrowband ultraviolet light or just UVB, like more powerful device, open their eyes thinking they're getting the signal uh, to their brain for UV light and just literally be blind for the rest of their life. So, you
Yeah.
know, there's a couple other things, but that I'm worried about. But yeah.
Yeah, so on that vein, what should we be looking for in a good quality red light? Because we know that red light therapy, it's, you know, it's out of the box now. Everybody's talking about it. It is very popular. I've always been very skeptical. I'm a nerd too, so I like to, you know, read research, and I only entrust in products and things that I know the due diligence behind the brand or the actual product has been done, and that's what I always felt with your company and your products from the beginning.
Thanks.
Yeah, what are the good things? What are some of the good things that we should be looking for in a good quality red light?
Yeah. So I think essentially the reason why all the red lights on the market look the same, you know, they just look like they have 3 watt diodes across them. That's like literally they all look the same, is because they are the same. You know what I mean?
Yeah, yeah,
It's like shocker, right? They're all the same. They're just basically like resold like Chinese devices. No one's actually done any innovation on them. No, if you see, none of them will get. They might have patent pending on like a wave light ratio or something like that, but they're never going to get a granted patent on it. It's just, you know, and but it comes down to a couple different variables. One is irradiance, which is the light intensity, how powerful the light is. So the more powerful the light, the better, because some people are like, oh, well, it's too powerful. It's like, well, no, a powerful light at least lets you treat at really high power if it's necessary. Okay. And then if it's not, you can move away. What happens is the light intensity falls off because it follows what's called inverse square law, which means the light intensity drops off exponentially as you increase distance, and then you just get more coverage, right? Um, the other thing is, so that's, it's called irradiance. That's important to understand. The more powerful the light, the greater treatment versatility you have. The second thing is flicker. Most of the lights are getting like fairly well optimized now because you know, it's been like 5 years. 5 years ago, we were one of the first companies to actually reduce the flicker. That was I sent it to Jack Cruz, and he tested it. He had his scientists test it, and it came out to 3.2%. And he said, "Good news, you know, this, you know." So, um, some of the lights you can tell really quickly. You can just take your iPhone and do slow motion videotape, and they'll be blinking. Likely the ones in your ceiling, because they're not going to be optimized at all. But so flicker causes central nervous. It's basically when the light like blinks, but you can't see it, but your essentially your cells recognize it, and that causes central nervous system. Yeah, so it causes central nervous system dysregulation. It can cause seizures in epileptic people, but it causes central nervous system dysregulation. Everybody, the sun doesn't flicker. and we're actually the first company to use Meanwell power drivers, and they have actually eliminated the flicker, which is that I think we're the first one to completely eliminate it. There are a lot of companies will say no flicker, and that's definitely not true because, yeah,
Yeah,
it's not
I've
true.
I've seen that in some of the other companies in their advertising, and I don't know. Just my intuition was like, really? I'm not sure.
Yeah.
Yeah,
No, because it took us so long to figure this out, and I don't care. We're just it's they're Meanwell power drivers are very expensive. You can Google Meanwell power driver and look how expensive it is. The
yeah.
normal ones that people are using are anywhere from $5 to $10. These are like 60 to 100. But the next thing is electromagnetic field production. So
Mm-hmm.
non-native, which means like artificial electromagnetic radiation, is not good for your body. It is kind of counteractive when you're trying to use a piece of health technology, like a red light therapy device. So,
Mm-hmm.
yeah, I mean, our devices have always been really clean, but with the new Pro Series, the Meanwell, we actually are also not only did eliminate the flicker, it increased the irradiance, which we're already winning on, by the way,
Wow.
and it eliminated the magnetic field completely. There's still an electric field, but it's very well managed. And so we're also the first company to to eliminate the magnetic field. You can take a meter and push it right up against the bulb, and it's gone.
Yeah.
Yeah,
Okay, that's incredible. That's incredible.
yeah,
And okay, so I know that a newer thing that you've been working on, but it's not really new for you though, based on what you went through with the vitiligo, is the UV lights. So can you tell us a little bit, what should we,
hmm
be able to experience with the UV light, and now integrating the UV with the red light, which is more like what the sun actually naturally has. Can you tell us a
exactly.
bit about those wavelengths and more about the UV?
Yeah, so ultraviolet light, like, so there's UVB, there's UVA, UVB, UVC. We don't get UVC light, it's blocked by the ozone layer. It's highly mutagenic. For example, like um, 254 nanometer UVC at an irradiance of 2.5 uh, milliwatts per centimeter squared kills all viral DNA. And I actually know that because I made a robot that goes around your
Uh-huh.
house at night that emits UVC 254, and
Uh-huh.
to about 6 feet, it'll disinfect like all the knobs in your house and
Oh my
everything.
goodness.
And yeah, we patented it, so we'll be releasing that under a new company. But yeah, so and I'm saying this for a reason because it ties in to what I want to talk about the safety of ultraviolet lights on the market. Um,
Mm,
so you want to be using 311, 312 nanometer ultraviolet B for the UVB, and you want to be using broadband UVA. You always want to be using UVB, UVA with UV, or sorry, UVB with UVA. You don't want to just isolate UVA, and the
okay.
reason is because, and that's why tanning beds are bad. Okay, because
Yes.
UVA is what oxidizes your melanin. So I have to explain this whole system here.
Okay, yeah, please do.
Yeah, so this is called the natural human, and this is why I personally, and this is not emr-tek's opinion. So I'm going to tell you some very intricate knowledge, but when you think about how intricate this human protection that you this natural photo protection or sun protection you actually have is, it's
Mm-hmm.
like, well, okay, do I trust this or do I trust the pharmaceutical industry? So
Mm,
what happens when ultraviolet B hits your skin is it stimulates melanogenesis. That's the formation of melanin. That's the
right.
pigment that shields us from the sun.
Mm-hmm.
UVB also, when it hits your skin, not only does it generate melanin, but it translocates or shifts that melanin to form what's called a supranuclear cap over your nuclear DNA. Okay. And then the ultraviolet A that penetrates deeper
Mm-hmm.
goes down, and instead of hitting and causing direct DNA damage, it's blocked by the supranuclear cap. It's like an umbrella shield of melanin. That's literally what it looks like. And I've
Uh-huh.
seen pictures of it.
Wow.
And so it's creating a shield in front of your nuclear DNA. And then the UVA hits the skin. It creates a lot of reactive oxygen species,
Mm-hmm.
and the supranuclear cap of melanin actually acts as a free radical sponge, soaks up all those reactive oxygen species, and it oxidizes the melanin, and that's why you turn brown. So, like when you cut an apple in half,
Yes.
The inside's it's exposed to oxygen. It
Oxygen
turns
and
brown.
right.
That's what's happened to your skin. That's how you
Uh-huh.
tan.
Uh-huh.
There's 3 stages, but that's the acute phase tanning, and that's what UVA does to you. So think about the tanning beds that are used for acute phase tanning primarily, because that's
Mm,
why you get out of the tanning bed and you're much more brown, right?
right. Yeah.
But they lack a lot of UVB, so you're not getting the melanogenesis. You're not getting that signal to translocate it to the apex of the nucleus. So you really got to be careful with that.
Mm-hmm. Mm-hmm.
And then on top of that, if you're applying sunscreen, then it's like, well, the UVB is what creates erythema, which is it's essentially when you turn red, right? It's called
Right.
like a burn, but it's not actually a burn. It's just the blood coming to the surface of skin to
Right.
harvest the ultraviolet light into your blood. That's why you can push on your skin and it
Mm-hmm.
just it looks turns white. You're literally like displacing blood, right? And you can
Yes.
pull 60% of your red blood cell mass in your skin before your organ systems fail, which would be like a terrible burn. But so when you apply sunscreen, you're blocking that UVB signal. That's why you don't turn red. So you're
Mm-hmm.
not getting melanogenesis. You're not getting the melanin translocation. You're not forming the supernuclear cap. You're just going to get blasted by the sun.
Right.
Um, and so what it comes down to is like, if you're going to apply sunscreen, then you're taking the word of the pharmaceutical industry. Essentially, you're saying that my body and its adaptations over millennia, and it's not even just in humans, um, to deal and protect us from the X factor that created all life on this planet
Mm-hmm.
is not effective and not sufficient. And that
Yeah.
we need to put on some chemicals to
Mm-hmm.
do that. So there's really no way to argue that, and from what I can see. So you'll be choosing that instead of the amazing protection that your body offers naturally.
But you
And
have to
so
build it up, right? So can we use the red lights to build up, as Dr. Jack Kruse talks about the solar callus? In my new book, I talk about,
yeah,
building your solar shield. Like how can
for
we
sure.
effectively use our red light? Let's say we're going on a sunny vacation, a month from now. How can we do that? Can you enlighten us a little bit?
Yeah, I mean, so you'd want to so the reason the sun is red in the morning and red in the evening and the ultraviolet is in the late morning to afternoon is the red light preconditions your skin to accept the ultraviolet light, which
Mhm.
induces inflammation, and then
Yes.
red light actually resolves acute inflammation as well. But that's one of the things it's most effective at. So it's preconditioning your skin, and it's actually shown in the literature to reduce erythema, the burning, literally what sunscreen does, but
Yeah.
it's natural. Okay.
Yeah.
So and then the inflammation that's induced by the ultraviolet light in the early morning and afternoon, that gets resolved by the red light in the evening. And red
Hmm.
light resolves acute inflammation by modulating the soluble protein mediator cocktail in the blood. So there's messengers that say go into an inflammatory and anti-inflammatory states like chemokines, fractalkines, cytokines. You probably heard about them in like the COVID thing when it was like
Of
cytokine
course.
storm.
Yes. Yes.
Right. And and so it modulates the cocktail of those SPMs in the blood to make it a more anti-inflammatory message. You can get onto like you can resolve the acute inflammation better.
Wow.
And
Yeah.
yeah, and so red light builds what's called I forget exactly how to say it. I think it's called a stratum corneum. It's that
Yep. Yep.
portion of the skin. It actually makes it thicker. And like when you lift weights, your skin gets thicker. You get calluses, right? Well, there's
Right. Yeah.
something called like a solar callus, like you just mentioned.
Yes. Yeah.
And and that's essentially what happens when you expose your skin to red light and UV light, but you need red light to build it up. So you can
So,
you can you
yeah.
can theoretically use the red light panels to precondition your skin for ultraviolet light.
And so if somebody's starting out, let's say you've just got your new red light home, how do you usually suggest that we're, starting with our exposure? if we're under blue lights a lot, we live in a modern, North American lifestyle or Northern European, we're under artificial lights, blue light. We're on screen time all day. How would someone slowly build up their exposure to the red light, and how much exposure of your body? Like, should we, take off all our clothes and do it?
Yeah, take off all your clothes. Yeah, that's generally what's recommended.
Yeah.
Um, I, there may be like nuances to that. I can't really think of. Oh, maybe if you're like pregnant, I wouldn't like shine it directly on your stomach.
Right. Okay.
That's something, things like that, because there's been no data, because it's kind of like what's it called, like morally incorrect to like study it on like infants like that are in like utero or whatever.
Mm-hmm.
Um, but so there's like really no data on that. The only thing that I read was that it increases the size of the rat babies. So,
Oh, yeah.
which is, I don't know, I probably wouldn't want to increase the size of my baby. Anyways, I'm
I
like,
would
they're
not.
big enough. No,
Yeah, exactly.
absolutely not.
Oh
Yeah,
my
no one's
goodness.
going to be doing that now. But I think we have like a guide that comes with all our lamps. Essentially, what we say,
Starting slow would
it,
be
the
your
gen,
suggestion. Yeah, like 5 minutes at the beginning for the first week or so. Like, as I'm just trying to generalize for a lot of people that are going to be
yeah,
watching, and that maybe they don't have experience, or they bought the wrong light, and
sure.
until they
So
get the
I
right
can I
light,
can
yeah,
tell
and
you,
they're starting. Yeah.
for like approximately devices of like 75 to 100 milliwatts per centimeter squared of a radiation, that's what you're getting. The general consensus is like 15 to 20 minutes,
Okay.
depending on the depth of the target tissue, and the amount of obstructive tissue in front of it. So like if it's like a you're really trying to get into a joint there, and it's like covered by like a dense bone kneecap, and
Yeah. Yeah.
maybe you want to go a little bit longer at like
Hmm.
30 centimeters
Okay.
distance instead of
Distance
80.
from the
If
light.
you're looking
Okay. Yeah.
if you're looking for like skin rejuvenation, I would go more on the like 80 centimeters away for less time. You know what I mean?
Okay.
Um, you know, and so you kind of do it like that. That's the best way. But our lamps come with guides, and my customer service team is pretty well trained.
Okay, that's amazing. And for the ladies who, well, anybody who wears makeup, I shouldn't qualify that or quantify that. But anyways,
That's
anybody
right.
who wears makeup, it's always recommended to remove makeup, right, and have clean, fresh
Yep.
skin. Yeah, in before we, are
Do
sitting
you know
in
what's
front of our red
funny?
lights. Yeah, tell me.
I used to wear makeup because of my vitiligo. It
Oh, of
was that
course.
bad.
Yeah.
So
Yeah. I
I'm so
know. Yeah.
offended, Janine.
I'm so
I'm just
sorry.
kidding.
Right?
It's all right. It's all right.
That's what I said. I caught myself.
Yeah, well, there you
Oh
go.
my goodness.
We'd be out here wearing makeup.
Yeah,
Yeah.
yeah. Well, I know with vitiligo, I can only imagine, right? I did have patients with it, and it's interesting. I did have one patient, and she had like this remedy from, I don't know if you're aware of it. So it involved ivory tusks from an elephant, which I believe was the calcium or maybe the makeup of the actual tusk. And there
Hmm.
was this whole thing like she was from Greece, and you had to rub a copper penny on the skin, and then you had to put this ivory tusk, or they used to, if they couldn't find an ivory tusk because they're banned, in a lot of countries now, of
Yeah,
course, piano keys,
yeah.
like they would have to find an old piano and use the ivory piano key, and then they would like mash that down and then put it in a solution, and it had to be in the sunlight, and it like made this whole thing. But I saw the actual effects of this on her skin. So I think with the UV and
Really?
your whole story, and yeah, it was very, very, very
That's wild.
fascinating. Yeah, yeah.
That's
So
wild.
as an aside. But some of the research is now showing, and I know it's so slow for red light therapy. It's not like a drug and a pharmaceutical. There's not a lot of, but correct me if I'm wrong, if there is, people investing in the fact of doing these clinicals in terms of anecdotal evidence, in terms of hair growth, anti-inflammatory effects, of course, for the skin, for collagen boosting. So I know you can't make claims about anything,
Yeah,
related to
it's
the red
okay.
lights, but what are some of the stories or anecdotes that you've heard or
Yeah,
experienced?
I just can't talk about my lamp specifically, but I can
No,
talk about
yeah.
like red light therapy. Yeah, I can. Well, actually, it is my light specifically, but I can tell you things that people are reporting, which are
Yeah,
super
please, yeah.
strange. Okay, so
Yeah.
the most weird thing is I've had. like these are unsolicited. So when, you know, obviously if I was going after it would be different, but
Yeah.
like these are completely unsolicited. I had two doctors on different on multiple different times come to me separately and saying that these my lamps were taking cysts off patients, like
Wow.
internal cysts on
Wow.
livers, kidneys. So I had a girlfriend and she had type 1 diabetes and she would get cysts. And once I
Yeah.
heard that, and I was like, okay, well, let's try it. She used to have surgeries on it. They would go away. I don't know what happens if it restructures the water and they like reintegrate into the body or something, but it works.
Wow. Yeah. Yeah, can you talk a little bit, which we haven't gotten to yet, which we probably should have started the show with this, was what's the mechanism? Like the red light and the mitochondria. Can you just put that together for our
Sure.
viewers a little bit? Yeah.
Yeah. So like, long story short, well, I don't know if I can do that.
Yeah, you can.
Uh,
It's okay. We got lots of
I'm
time.
not made for that. I'm yapping.
No, it's good. It's all
Okay,
good.
so 630, 670, and 830 nanometers. Those two wavelengths in the red visible spectrum, 830 is in the near infrared spectrum. Those three wavelengths specifically, like photobiomodulation is like 600 nanometers to like 1,000 nanometers essentially. Okay,
Okay.
but those three wavelengths are the most biologically active. There's there's five proteins in the mitochondrial electron transport chain. Okay,
Yeah.
the fourth is called cytochrome C oxidase. When these three wavelengths hit the fourth enzyme in the mitochondrial electron transport chain, they unbind nitric oxide. It's
Hmm.
through a process called photodissociation. Okay, but essentially they're just like unbinding it from the electron. And because oxygen and nitric oxide compete for flow down the train, when you would release the nitric oxide, oxygen is more effectively processed. The net result is increased adenosine triphosphate, which is chemical energy that the cells use to complete their daily tasks, which is
Yes.
like 100,000, uh, which is a lot. So essentially, it turbocharges your cellular engines. That's kind of like how I like to explain it, kind of in like layman's terms. It like turbocharges your cellular engines. It provides you with more chemical energy on a cellular basis for your cells to complete their tasks. And 80% of, and then it also reduces inflammation by the what I told you earlier, by it modulating the protein mediators in the blood. So there's fundamentally two ways that it's really helping your body. And if you weren't aware, 80% of the diseases that are killing people, like type 2 diabetes, heart
Hmm.
disease, Alzheimer's, certain types of epigenetic cancers, and there's one more I forget, those are killing like 80% of people essentially right now. And those fundamentally are from mitochondrial dysfunction, a lack of ATP, and chronic inflammation
Hmm.
combined. So it's pretty powerful. And also the ultraviolet lights actually increase vitamin D. And because vitamin D, well, vitamin D is like related with like all a vast majority of like decreased pathology, right?
Yeah. Yeah.
But vitamin D and inflammation are actually inversely correlated. So if vitamin D goes up, inflammation is generally going to go down. And
Hmm.
people haven't really thought of this too much in my industry, but they're like, it's UVB that increases vitamin D. But actually, if the red light reduces inflammation, that can theoretically increase vitamin D as a byproduct. So when you combine the two, you're really going to get like an amazing vitamin D response, and then also, kind of like a synergy in terms of anti-inflammatory.
Wow. Yeah. Well, that's great. Thank you for breaking that down for us, because these are all things that I've talked about in my social media and educating people, but you so eloquently put it all together with the red light. So that's important. Thank you. Thank you. Now,
And
yes,
oh,
and
go
yeah.
ahead.
No, go ahead. Go
And
ahead.
And so the fluorescent lights, the
Uh,
fluorescent lights
yeah.
that we use We use 311, 312 nanometer UVB. That's actually the least mutagenic wavelength. So it has the
Okay.
lowest mutation frequency. That's why it's used in all the clinical literature. There's devices out there that are using ultraviolet B LEDs. There's actually FDA reporting requirements because I have a federal regulatory consultant on payroll. So he
Yeah.
advises me of this stuff. I guarantee you none of these companies are actually doing that. And the problem is that I actually saw um, one of these devices and measured it, and it actually had a UVC diode in it.
Oh my
Swear to
God.
God. Okay, so yeah. So that's why there is these requirements. And then on top of that, there's two companies I've seen. There's probably more, but uh, uh, it says there's a study that came out that says 294 nanometer ultraviolet B LED, but it doesn't matter if it's LED or fluorescent. It'll still do the same thing. But 294 nanometer UVB synthesized vitamin D in the skin 10 times more effective than any other wavelength in the UVB spectrum comparatively. So these companies make it, I can make it cheap because it's a lot cheaper to do LED,
Wow.
right?
Yeah, yeah.
Um, and 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 they make it but 294 has no safety profile at all. There's no safety profile. We have to be
Wow.
super careful when we're isolating wavelengths because, like I said, 311 is the least mutagenic. So there's definitely ones that are more mutagenic.
Right.
And
Yeah.
for example, like in the UVC spectrum, 254 nanometer is like the most mutagenic. It kills all viral DNA. So you got to be really careful with that.
Mm-hmm. And you would, I mean, I think we should make it clear to anybody who's watching or you're learning about red light for the first time that it's not a replacement for the sun. I mean, natural sunlight exposure is always the ultimate health-giving, spectrum, full spectrum light. And
Yep.
I think there's definitely a place, though, for the red light therapy and the UV now as well, for people who simply can't move to the islands or closer to the equator. And if you live like in Canada, like I do, and try to get away as much as possible, but to be able to use the red light as it's not even, I don't want to say that it's the wrong word, but it is a Band-Aid in a little way, right? But at the same time, if you're using it in the right way, and that's where I think, doing podcasts like you are, Kris, is such an amazing gift that, it's great for you to be able to speak out and enlighten people that the tides need to be shifting and people's awareness, and, the research needs to go into this area of, natural medicine to be able to get back to our roots. And that's the whole premise of my new book that's coming out, is like reconnecting with what we've lost. We've lost this connection with sensible living. Get outside, right? Whether it is cold or not, no matter where you live, like get outside under natural full spectrum light and do your best to be the way that we're supposed to live as humans, mammals on this planet, right?
Well, yeah, and phototherapy is kind of like decentralized medicine. So
Yeah.
down here, I'm in El Salvador, and I actually don't use red light therapy or like
No.
any phototherapy when I'm living in the tropics here.
Right.
I only use it when I'm back in Canada, um, and but sometimes in the summer too, because it's just like cloudy days. Usually here it's like sunny, but you know, it's weird. It's a weird connection, but with Bitcoin, and Bitcoin is not my savior. I get turned off by people who like talk too much about Bitcoin. To be honest with you,
Yeah.
but like I'm just gonna use it as an example and tie it in because it's kind of interesting. Bitcoin is like decentralized finance. It takes
Right.
away the power from the banks, right?
Yes.
And phototherapy is a form of decentralized medicine.
Right.
And these are my lamps are general wellness devices. Okay, they're
Yeah.
not like medical devices, and
Right.
it's not a medicine. But in some cases, phototherapy would be considered like decentralized medicine if it was in like a clinician's office and they had some like certain claims were being made and yada yada, and that is taking some power away from big pharma and putting it back in the hands of the people, and I really like that.
Absolutely. I'm definitely on the same page there. And that's, something that I teach as well, that, take your body and what's going on with your own physiology into your own hands and educate yourself. And a lot of things just are simple ways to get healthy And sometimes just people need to be guided in the right way, and that's what I'm all about. That's my life's work. So
Hmm.
another question as to, I'm thinking specifically about, what the viewers are going to be asking in terms of, okay, how do we use it? I have a question. Being under artificial light all day, in our homes, in our offices, here in my studio, can we use the red light and kind of have it off in the corner, either facing towards the room, or can you bounce the light off a wall just to have that ambient red light throughout the day to offset some of the blue?
I mean, you can also use the bulbs on our website. It's under indoor lighting solutions. So we have
Yes.
daytime and nighttime, but you
Yeah.
can use the nighttime for the daytime. It doesn't really matter. But
Yeah.
the thing is, we have so much blue light. By the way, just to segue here, um, back to like when I was talking about like sunscreen stuff. Do you actually think it's the sun? Because when you look when artificial light was introduced, that's when
Uh,
the skin cancer started to happen. So is it
mm-hmm.
like the X factor of life, or is it like the stuff that we made, like that we know
Yeah.
causes like anyways.
Right.
So yeah, to balance it, like essentially blue light, red light is like the antidote to blue light. So blue light, for example, blue light makes the mitochondria swell. When the mitochondria swells, the proteins in the electron transport chain get increase in distance. For every 1 angstrom increase in distance, electron quantum tunneling decreases by a factor of 10. Okay, so
Yep.
the slower the tunneling of electrons through the electron transport chain, the least ATP you're going to make. And
Right.
like I said, that's fundamentally what's killing people. Okay,
Yeah.
but
Yeah.
red light shrinks your mitochondria. Okay, it
Uh-huh.
condenses the protein. Electrons quantum tunnel more effectively, and the net result is more increased ATP. And so, but there's a lot of different things. Like blue light drains your melatonin. Red light is shown to increase your melatonin. Also,
Mm-hmm.
subcellular melatonin.
Mm-hmm.
Um, Blue light is short wavelength light. Red light is long wavelength light. It's just like literally the opposite. And we're drenched in blue light. It's the number one non-native EMF. It's probably the number one environmental pollutant right now.
Mm-hmm. Yep.
Um, and if you don't think, altering the X factor of life, that of the X factor that created all life on this planet is going to have biological consequences, is
Mm-hmm.
gonna.
Yeah.
And so the solution for modern times is to introduce red light
Right.
into your environment, and that's super easy to do with my products.
Yeah, we do actually in our office, most of our offices. So my team here, they have your lights, so the light bulbs.
Okay,
But
exactly. Yeah.
I'm just thinking personally, because I spend time in the studio here when we're shooting our social media, and I do, my lives or whatever, is to actually bring my fire dragon and have it here in the studio and just have it on when I'm under the studio
You
lights. I could,
you can
right?
do that too.
Okay, I'm gonna need to
You
buy
could
a
do
few
that
more
too.
lights. I'm gonna need a few more for all my, and when I'm on television as well, same thing. Like I was thinking of bringing, I can't remember what the little one is called, but just to have the little one like on the
The
set
fire
when I'm on
wave.
the fire wave when I'm on set on TV. That would be fantastic as well. Yeah, I might try
Do you want
that.
to hear about my new company?
Oh, please.
It's called not light fusion. No, not let's that sounds. It's called Light Fusion.
Light fusion. Okay,
So
yeah.
yeah, it's a
Tell
cosmetics
me.
company. So okay, you know that yeah, because you're gonna like this, and I'm gonna
Yeah,
give
yeah,
you one.
yeah,
And yeah, Christmas
yeah.
came early, so yeah, yeah. So like I've been like designing a face mask for a little while now. There's this Me Too
Oh,
product that's all everywhere. Like all the companies are selling it, but I was like, I don't want to do that to
like
emr-tek.
the light,
I think I
light,
can.
light on the face, Matt. Yeah.
Yeah, the
Is
face
that
mask where it's like got
okay?
the cutout and it's like a
Yes, yes,
silicone
yes,
thing and
yes.
you tie it around your head and whatever,
Yeah.
and you can like watch TV. The problem is it's right against your face, right? So I
Right.
was
Yeah.
like, so mine, I made it 3 millimeters off your face, and then
Okay.
but I also did that, so it's actually more comfortable.
Ah.
But also because of my experience with pseudocatalysts, where I applied a topical applicant to my skin that
Yes.
modulated different the biochemistry of my skin, and then it was and then I went in the light, and just that having that experience made me
Right.
realize that light and cosmetics can be synergistic. Okay,
Uh-huh.
and
Yes, yes.
so So this mask emits four wavelengths of light, except blue, because there was a Neutrogena recall because it was causing problems with people's eyes. That's the
Uh-huh.
benefit of having a federal regulatory consultant on
Yeah.
payroll.
Yeah.
But so we emitted the blue light, so it's got red light, green
Mm-hmm.
light, orange light, and yellow light. Okay, and
Wow.
then we have these. We manufacture cosmetics in our skincare in South Korea, like the hub of cosmetics. And so red light increases collagen elastin. So we have a sheet mask made in South Korea that it has like hydrolyzed marine collagen. It has
Wow.
vitamin C that enhances collagen synthesis, a bunch of different things to support the fibroblasts to make collagen. Okay. And then you put that on,
Yeah.
and then you put the red light on. But green
Oh.
light's good
Yeah.
for hyperpigmentation,
Yes,
which is
yes, yes.
something that women and men, but women are like really not a fan
Yeah,
of
we don't like that. Yeah.
hyperpigmentation.
Yeah.
You guys hate that. And so green light's really good at getting dealing with hyperpigmentation. So then we have a bleaching mask or a whitening. You have to say brightening, but
Yeah.
it's
Yeah.
whitening. Okay, who
Yeah.
cares? And I don't care. So it's a whitening mask. We use like niacinamide, alpha albutrin, different bleaching agents.
Yeah.
And so you put the mask on, and then we'll just use yellow light as the last example. That's really good for reducing redness. It can be actually pretty effective at treating rosacea. Not that we make that claim on the product, just
Of
our
course. Of
product,
course.
but it
Yeah.
technically, theoretically, it can. And
Wow.
and so we have like a really calming mask, like with aloe vera and different like calming ingredients. So it's
Yeah.
called light fusion. It's like the new
Wow. Love it.
the
Oh
new
my God,
era.
that's huge. Yeah, that's huge. Well, you're such an innovator, so that all the best luck to you because that sounds like it's like right on point. So, especially
Thanks.
for women,
I
I don't know
can't
why
wait.
we care. We care so much about our skin and our beauty, and yeah.
I was friends with Brandon Truax, the founder of Decium Cosmetics,
Oh,
Decium, the abnormal beauty company. Okay, and I
okay,
was
yeah, yeah.
actually had dinner with him. He just got ousted from his position as CEO by Estee Lauder,
Wow.
and we were supposed to expedite our passports because we were both crazy and didn't have our passports, lost them or something, you know, dude, just like ADHD guys. And then we're supposed to make this company, and so yeah,
Mm,
it's a long
wow.
story, but that's where it's come from. Yeah.
Wow. That's wow. Crazy. I'm
Yep.
trying to think on that note. I'm trying to think of
Yeah.
yeah, where I was going to go with your new light. So it's the Krypton, is that it?
Yeah, Krypton.
Yeah.
It'll make you like
Okay.
Superman.
Like Superman. Yeah.
Yeah.
So, can you just tell us the specific wavelengths that are in the new light and your sort of thought
Sure.
process behind adding in the UV now?
Yeah, so I mean, I saw a lot of, so it has 630, 670, and 830, and 850 also. That's really good for like muscle rejuvenation.
Yep.
But like, remember what I was talking about? Like those wavelengths hit the fourth enzyme in the mitochondria and unbind it. Yeah, yeah, yeah. Increase chemical energy is the net byproduct. So it's got all those wavelengths that the red and near infrared light do, but then it's got narrowband UVB, which in like one study, for example, but this is really well studied and this is conclusive that it
Hmm.
raises vitamin D. It synthesizes vitamin D from cholesterol in your skin, and
Wow. Yep.
we're not claiming that it fixes vitamin D deficiency. What we say is it supports natural vitamin D production, but in the clinical literature, for example, in like 2 weeks exposure, vitamin D deficient patients with narrowband UVB 311 through 12, Philips brand, which we actually use, so that increases the safety profile further because it's like the
Mm-hmm.
longest standing vetted ultraviolet product manufacturer with the safety profile wavelength. Um, it increased their vitamin D status by 70% in vitamin D deficient individuals
Wow.
in 2 weeks.
Yeah, that's
And
incredible. And how much exposure are we talking with using your lights? Um,
yeah, so it depends on your skin type.
mhm.
But we have like
Yeah.
we
So for
have like
instance, for me, I'm a type 2 probably, Fitzpatrick. So
mhm.
light skin. So it starts slow, right? Couple minutes
Well,
maybe?
yeah, I mean, you would want to work up a little bit. Yeah, you would
Yeah.
want to work up because you want to build up your solar callus, you want to
Yeah.
build up the melanin pigment in your skin. Um, but we have like safety kind of things in
Guidelines.
place. Like you can't go over, yeah, we have guidelines, but we also have like, you can't go over 5 minutes exposure. So no
Oh,
one's going to
perfect. So
fry
it shuts
themselves.
off? Yeah. Okay, that's good. That's good.
Yeah, and like we also have electronic ballasts that control the fluorescence. So the fluorescence, the lights don't actually flicker either. And then on
Wow.
top of that, there's some companies out there that um, th- they're not using Philips because those are too expensive for them, but
Mm-hmm.
they're using their own type of like OEM like fluorescent UVB bulbs, but they cover it with like like a cage, like a metal cage, and you
Yeah.
can Google what happens if my fluorescent bulbs break, and it's like anywhere from like, oh, evacuate the house,
Oh my
like, you
God.
know what I mean? Because
Yeah,
yeah, because
yeah.
they
It's
leak
dangerous
mercury.
stuff. Mm-hmm.
Yeah, so we have 3 millimeter tempered glass in front of it,
Oh, okay.
and to protect. So yeah, I mean, just and you can control each like wavelength. Like you control the red and near infrared light. You control the UVA separately, the UVB separately, or
Oh,
all
you
at the same
can.
time.
Oh,
You
okay.
can.
So it's adjustable. Yeah. Okay, that's great.
Yeah.
So yeah,
Hmm.
perfect. And again, exposing as much skin as possible with the goggles, right? It comes with the goggles, I'm guessing.
Yeah, it comes with
Yeah.
the goggles. You
Yeah,
should
good.
definitely wear them. Yeah,
Yeah.
I mean, just talking like I've seen a horror story once, not with my product, but my friend in Poland. Like this guy burned his light on UV so bad, and what
Wow.
happens is the skin goes red, but the eye actually will go bloodshot red. And
Oh
he
my
was
gosh.
walking around with like blood red eyes for like a
Wow.
week wearing sunglasses. It was horrendous. So that's part of the reason why I'm like adamant that you should always use eye protection. We are doing a clinical study though
Oh, you are?
on yeah, with a
Wow.
doctor. We're in the process of figuring it out. His name's Eric Nager and is a medical doctor in the USA, and we're actually going to be testing vitamin D, mitochondrial I forget what it's called. Anyway, biomarker and a couple other things. So
Wow.
we're going to fund that, but it's not
Oh,
a
that's
biased funding. Like
that's all right.
yeah,
That's great. Well, that's
it's the best we
exciting.
can do.
I'm glad because yeah, the more data that's I mean for the people that need to see the data, there's certain types they always need to see the data and other people it's like it's more practical information that they're
Hmm.
looking for and if it works for you, it works for you, right? All right, was there anything else that you wanted to add in before we close?
Just one other thing that I'm going to be doing is I'm going to be going live like on a weekly basis for all my customers, and they can just come in every
Oh, that's
single week.
great.
I'll go live. I'll go live like broadcast, so you'll be able to check in with me and ask all your questions like on a
Oh,
weekly
that's
basis coming up.
perfect. Yeah,
Yeah.
that's a great thing. Yeah, because people like to interact and ask their questions. And I always say when I'm
Oh yeah.
live and do social media, it's like your question is answering so many other people's questions, right? Whether they see it live in the
That's right.
moment or of course on social media it lives forever, right? Well, sometimes.
Yeah.
So
Yeah. Yeah.
that's
Yeah.
yeah, no, that's great. And also, let's talk just for a second on the blue light blocking glasses. I know you have a bunch of different varieties,
Yeah.
and it's something that there's a lot of brands, I believe, that are out there and they're not properly tested. Can you tell us a little bit about, again, what are we looking for with
Yeah.
your quality of blue light blocking glasses? I have multiple pairs of yours. I have these ones.
Yeah, yeah, yeah. So
Yeah, the
those are
Wolverine.
actually 24 karat gold plated stainless steel, like real
Aren't
24
they?
karat
I'll
gold.
put these ones on.
I
Yeah, they're so good.
you're gonna
Yeah,
look like yeah, you're
I
gonna look
know.
so cool. They fit your
Yeah.
face. Oh my God,
I love them, yeah.
that's the best. Yeah, you should be our personal model for the Wolverines.
Anytime. I have two pairs
So
actually in my studio here. It's not a joke. Like I have, yeah, I always show them when I
oh,
do social
we're
media.
gonna have to get you
These
all
are the best
the.
ones.
I just made new ones with like Italian acetate German hinges. That's what they do in like the luxury, like Gucci and like Louis
Oh,
Vuitton
wow.
stuff.
Yeah,
And
yeah.
I made them from candy from the Primal Bod. So
Okay, yes,
we'll
yes.
have to get you a pair there. Yeah,
Oh,
yeah.
awesome. Awesome.
They're really nice. I'll ship you a pair, but they're really cool. So blue light glasses. I mean, I'm an e-commerce founder. There's an e-commerce business. I'm on the computer all the time. This is my third interview today. I'll be
Yeah.
doing another one. It's exhausting. If I didn't
Hmm.
have these, I would probably look like a zombie.
Yeah.
Like I start getting bags under my eyes. I'm just talking about the cosmetics, but we have the highest density of mitochondria in our eye, and
Mhm.
blue light damages the mitochondria so bad. So there's also a thought that cataracts, the reason why they're yellow is because they're doing exactly this. They're
Yeah,
protecting your brain from the blue light.
exactly.
It
Yeah.
causes neuroinflammation. It causes like inflammation, ocular inflammation, and it actually causes systemic inflammation. The main thing, the most important thing is to control the light that's hitting your retina, because that programs your entire metabolic system. Um, you know, so these glasses, for example, they block 90% of the blue light, because if you block all the blue light, you're going to be tired. So our red
Yeah.
lenses block 100%.
Yeah.
Okay, like the blue and the green light. Like for example, like if you go driving with our red lenses on, and you're going to be sitting at the go light forever, because it's not going to turn green at all.
Right.
And
Yeah.
that's how you know if they're really working, at least the red ones, because the colors that are supposed to be blocked are actually gone.
Yeah.
And
Yeah.
and those are what you wear like 30 minutes before bed, or like just leave them on your bedside table.
Yeah.
Turn on your red bulbs,
Yeah.
and if you got to look at your phone at night, you just put those on,
Yeah.
and it preserves your melatonin and your circadian biology, your circadian rhythms, which
Yeah,
are
it's funny
super
because
important.
when we have people over, like for little get-togethers or parties at our house, a certain hour, I go upstairs to my bedroom and get my red glasses and I put them on and like, oh, it's time. Dr. Janine's
Oh
winding
yeah.
down now for the night. Yeah,
Ooh,
it's like the
everybody
signal.
knows.
Yeah, like everybody get out. It's time for
That's
bed soon. Yeah,
funny.
it's
That's
funny.
funny.
Yeah, yeah,
I might do that. That's actually
yeah.
a
No,
good, really. It's like
no,
when
it's
I
good.
put
I
on the red
have
glasses,
to.
you got 30 minutes.
Yeah, right. Everybody out.
That's
No,
right.
it's good. It's like it's like a joke now, but no, I always have the red exactly like you said. They're right beside my bed, and when I'm
It's
winding
like,
down, and yeah, the kids are hopefully off to bed or not to bed, and I've got my red glasses on, and
yeah,
but
you
they
put
do
the,
put you to sleep. I mean, they do. Like
they
I'm out.
do.
Yeah, I'm out.
They do. They
Yeah,
legitimately do. Yeah, and they're good for the lingerers. That's
yeah,
right.
right. Yeah, that's great.
Cool.
Anyway, thank you so much, Kris. I had such a great, chat with you today, and I know that, my audience is going to absolutely eat up this information. You really helped to explain the physiology a little bit as well, which I think is important. I always find if people understand why we do certain things, and a lot of people talk about red lights and, light therapy, but if you understand the why, then that gets you to the next step of actually doing things therapeutically for yourself and for your family. So I thank you for those explanations and for your company and everything that you've done for this industry and are continuing to do as well for the beauty stuff as well that's coming down the pipeline, which
Yeah.
is I'm super excited about. But
Yeah.
congratulations to you and everything that you do, and I wish you all the best. And I'm sure that we'll talk again soon.
Absolutely. Thank you for having me. I appreciate it.
Thank you.